Finley. I'm a senior research scientist for the Center for Health and Safety Culture at MSU. I have a PhD in human services and a master's degree in social work from Colorado State University. And at the center, I really assist with the center's basic and applied research into defining and measuring and transforming culture. My primary areas of interest are really focused on behavior change and understanding people's intention and their motivation and how those influence our behaviors. So many of you are probably really familiar with WebEx, but just in case you're not, there is a chat box if you're having any questions or having trouble with the technology. I have my colleague Karen on the phone, and she can help with those. We also have a Q&A box that you're welcome to put any questions that you have into the box. We're going to be recording the webinar today, and it will be available on our Center for Health and Safety Culture YouTube channel. So at the Center for Health and Safety Culture, we are an interdisciplinary center, and we serve communities and organizations to really cultivate healthy and safe cultures. Virtually all of our research is conducted in partnerships at the community level, at the state level, and nationally with people who are seeking to improve health and safety using cultural strategies. The COVID pandemic is affecting each one of our lives. It's affected how we work and how we play. It's affected how we interact and how we socialize with each other. The COVID pandemic has had a significant impact on public health. The last I looked, I know that more than 290,000 individuals in the U.S. alone have died as a result of COVID-19. And slowing the spread of COVID-19 is essential and proving to be extraordinarily challenging. So during our time today, I'm going to provide an overview of a project that we did to understand the cultural factors influencing wearing a mask and getting a vaccine. We're going to discuss what we learned about behaviors and beliefs and practices of wearing a mask and getting a vaccine. And then we'll talk about ways that we can use the data, the data that we gathered to influence interventions and strategies to increase these protective behaviors. Our hope is that this information will be helpful to you as you think about strategies you're using and creating to increase wearing a mask and increase the acceptance of a vaccine to prevent COVID. Our research today, this research that we did was sponsored by the Office of Research Economic Development and Graduate Education at Montana State University. So we wanted to better understand the culture of wearing a mask and getting a vaccine. And we define culture as the shared values, beliefs, and attitudes that influence the behaviors of a group of people. Now, some might look at culture and consider it negative or bad. When we look at culture, we look at culture as good, as something that's worth growing, and we want to shine a light on that. Now, of course, there are some aspects of culture that are negative, and we want to address those. But for the most part, culture is good. At the center, we frame all of the work that we do with the core assumption that the positive exists and it's worth growing. We clearly believe that the solutions are in the community. So we set out to create this survey to explore the cultural factors influencing wearing a mask and getting a vaccine. And these two behaviors are what we would consider deliberate behaviors. Deliberate behaviors really are a result from an individual's willingness or their openness to doing the behavior and their intention or plan to behave in a certain way in the future. Willingness and intention are determined by a belief system, and that's influenced by the culture or the social groups that we identify with. And I wanted to start today by sharing a little bit of background on the survey, how we approached the survey, and then how it's grounded in a behavioral model. So we developed a survey using a complex behavior model to develop the survey question. And this slide really shows a simplified version of that behavioral model that we used. And I wanted this to show you this slide, not to teach you like our process in developing surveys, but I wanted to show you that our process to illustrate that there's a method to our madness. We use science to inform every aspect of our project. So a person's behavior, essentially this says that a person's behavior is influenced by his or her values, attitudes and beliefs, and willingness and intention. So cultural factors are a term that our team uses. And essentially when values and attitudes and beliefs are shared and predict behavior, they're called cultural factors. And it's our work to really study them and to grow them. For example, we can look at really any issue and look at the cultural factors. So we could say, what are the cultural factors that predict underage drinking? And then how do we grow those to improve health and safety? In this case, we're looking at the cultural factors that predict mask wearing and getting a vaccine. And then how do we grow those cultural factors to improve health and safety? Having a model provides us with this empirical foundation for how beliefs and behaviors predict other beliefs and behaviors. It helps us to understand what we need to grow and also inform us about, what we need to change. So here's a slide of the actual complex behavior model that we used in developing the survey. And I think if you think about this model, the takeaway message is that in order to change behavior, our efforts need to focus on changing beliefs. So the survey that we did was developed based on what we knew in the literature so far, and we also did 2 pilot tests. A review of the literature was really important to us because we wanted to see what others had done already. There was a lot, especially in the beginning of this pandemic, there was a lot of brand new research coming out about the pandemic, about behaviors and things like that. So we wanted to see what was out there because we wanted our survey to be informed, but really add to the current knowledge. And then we pilot tested the survey twice with a convenient sample of adults that were living across the US, and we recruited them online. And then we refined our survey based on those pilot testing results. We administered the survey in the middle of October, and we used Qualtrics as our survey platform. So to give you an idea as to who took the survey, we had 1,041 adults who were living across the US who took the survey. It was a pretty equal split. About half were female, half were male, and the age ranged between 18 and 70. We had a variety of different ethnic groups take the survey. We also asked about living arrangements, whether people lived alone or had children or lived with people who were over the age of 65. We had 41% who lived in an urban area, 41% in a suburban area, and 18% indicated they lived in a rural environment. The educational attainment of the participants varied. We had about 25% say that they had a high school education or less, and we had about 45% say that they had a bachelor's degree or more. We were really seeking to understand the relationship between beliefs and behaviors. So this was not a representative sample, but it was a large sample with a variety of demographics. And while it wasn't representative of the general US adult population, it did represent a variety of beliefs about getting a COVID-19 vaccine and wearing a mask. So the relationship between the beliefs and behaviors are salient to many adults, and I think provide us with some really important insights into efforts and things that we can do to increase vaccine uptake and increase mask wearing. So now comes the exciting part. This is where we get to look at the results and what we found about the cultural factors influencing wearing a mask and getting a vaccine. First, to kind of set the context, before we dive into the specifics of mask wearing and vaccines, we asked a couple of questions about people's overall concern about COVID-19. And we learned that there is concern, absolutely, about COVID-19. On the survey, we asked, how concerned are you in general about the pandemic? We asked about how concerned people are with getting COVID-19 themselves or with a family member getting COVID-19. And overall, we had 68% agree that they're very concerned about the COVID-19 pandemic. 63% were concerned about getting it themselves, and 69% were very concerned about a family member getting COVID-19. Now, having concern about COVID-19 in general is really important because in our analysis, we found that concern about COVID-19 was positively correlated with people's willingness and intention to engage in those protective behaviors of mask wearing and getting a vaccine when it's available. Several strategies, as we all know, have been proposed to reduce the spread of COVID-19. And one of those strategies that was recommended by the Centers for Disease Control and Prevention was to wear a mask, covering both our mouths and our nose and our mouth. Now, many states have mandated or strongly recommended the use of masks in public places. And we know there's controversy about mask wearing. You know, perhaps some of that controversy is linked to some conflicting advice given about whether, you know, healthy people should wear a mask or shouldn't wear a mask. Maybe some of that controversy is related to the seemingly political nature that this healthy behavior has been associated with. And, you know, these are just speculations, but we know that this is an important behavior, and more research is coming out all the time about how masks do help slow the spread of COVID-19. It's really considered a component of a comprehensive plan. So let's talk about specifically what we found. The good news is that most people, we had about 66% who responded to the survey that said they usually or always wear a mask when they're going to be around people, other people who don't live in their household. So while that number is positive, we know that there are opportunities to grow this protective behavior. There's still about 14% of the respondents who indicated that they rarely or never wear a mask. So you can see that we have opportunities to increase that behavior. And interestingly, we found that people with high levels of concern about COVID-19 reported that they usually or always wear a mask about 1.5 times more often than people who had low levels of concern. We also know that people have intentions and willingness to wear a mask. So I talked briefly earlier that wearing a mask is a deliberate behavior that results really from a person's willingness or their openness to it and their intention. And this was true in our study too. We learned in our survey that people have intentions to wear a mask. When asked, you know, how likely they are to wear a mask in the next 7 days, we had about 77% say that they are likely to wear a mask when they're around people who don't live in their house in the next 7 days. We also learned that there's high willingness among people to wear a mask. So in our survey, we asked about a variety of different situations or circumstances that people might be in or find themselves in. And you can see these are listed here that we asked, but you can see that people are willing to wear a mask. People's intentions and their willingness to wear a mask are strong predictors of mask wearing behavior. Overall, most people had really favorable attitudes about wearing a mask. What this told us really was that most people are supportive of mask wearing already for this COVID-19 pandemic. Positive attitudes already exist. So for example, we learned that 74% of the respondents agree that wearing a mask is necessary. 67% think it's safe, and 68% think it's helpful. And these are positive attitudes that already exist. From our analysis, we learned that attitudes are positively correlated with people's willingness and their intention to wear a mask. So growing these positive attitudes will likely increase mask wearing by more people. And we found that people with a positive attitude about wearing a mask reported that they usually or always wear a mask 1.8 times more often than people with a negative attitude. On this survey, we also asked respondents about their level of agreement with a variety of, I think 10 of them, 10 behavioral beliefs. And beliefs are beliefs about either the positive or negative outcomes of wearing a mask. And we found that they varied. People's beliefs really varied. I tried to in this slide show those in green that are supportive of mask wearing, and those in red that might inhibit, beliefs that might inhibit people from wearing a mask. So you can see just briefly, many adults, about 62% agreed that wearing a mask prevents them from contracting COVID-19, that it prevents transmission to others. About 69% thought that. But about 44% agreed that continuous mask wearing can cause health problems. It can increase the likelihood of asthma attack and interfere with daily activities. We also found that just over 1/3, about 36%, agreed that being told to wear a mask is a violation of their right. Now, all the behavioral beliefs were statistically significantly correlated with mask wearing and people's intentions and their willingness to wear a mask. And earlier I said that, all of the work we do is in partnership with communities. So when we think about what this data is telling us and how we can use it, we started thinking about interventions and strategies that are being used to promote mask wearing. For example, we learned that people who agreed that being told to wear a mask was a violation of their rights had more negative attitudes about mask wearing. When we think about interventions could possibly trigger some psychological reactions. And we know in the research there's a lot of things that we can do to reduce or address psychological reactions. So for example, we might want to think about using language that offers people choices or is more suggestive, like, oh, you might want to consider doing this, or there's evidence out there about this, instead of using language that's really strong or forceful or controlling, like you should do this or you must do that. In our survey, we asked people about people's perceptions of whether other people thought they should always wear a mask. These are called perceived injunctive norms. And we found that most adults, 71%, agree that people who care about them want them to always wear a mask when they're around other people who don't live in their house. And that's in comparison to about 16% who disagreed. Similarly, most of the people in our survey indicated that most people important to them would feel that it was acceptable to always wear a mask and that people were supportive of them if they did always wear a mask. People who perceived high expectations from others important to them about always wearing a mask were 2.7 times more, wore a mask 2.7 times more often than people who perceived to have low expectations. Perceived injunctive norms were strongly correlated with intention and willingness. So when we think about interventions to increase mask wearing, interventions may benefit from strategies that focus on family members and friends asking someone else to wear a mask. Those efforts could promote things like speaking up or asking people that you care about to wear a mask. While most people in the study, about 66%, reported that they usually or always do wear a mask, many did not feel that most others were wearing masks. About half of our respondents, 49%, perceived that most or all people like themselves wear a mask, but there was a pretty large group of people who didn't agree with that. And the takeaway message is that if we think other people wear a mask, this makes us more likely to wear a mask too. People who perceived most other adults usually or always wear a mask reported usually or always wearing a mask 2.4 times more often than people who perceived that most other adults rarely or never wear a mask. So what this tells us is we need to clarify norms. We need to grow the perception that wearing a mask in public places is the norm, and then we want to correct the misperceptions of that normative behavior. Correcting misperceptions has shown to increase the normative behavior in other contexts. So when we think about interventions for mask wearing, we want to promote the beliefs that most people wear masks and avoid growing misperceptions that most people don't. People's sense of control about wearing a mask matters. Many people on the survey agreed that it was difficult to always wear a mask, but they also agreed that they're capable of doing it that they knew how to do it, and that they had access to an effective mask. But we also found that about a quarter of the respondents did not agree that they were capable of always wearing a mask, knew how, or had access. People who had a higher sense of control about always wearing a mask reported wearing their mask 3 times more often than people who had a low sense of control. So the takeaway message is that when we think about strategies, we need to incorporate ways to bolster people's sense of comfort and confidence to wear a mask. We also looked at the data to see if we saw any gender differences in mask wearing. And research in the past has suggested that females are generally more responsive to engaging in protective behaviors. And we wanted to understand gender and the cultural factors that are influencing mask wearing. We did find in our survey that males reported wearing a mask less frequently than females. Males reported lower intention and less willingness to wear a mask. And females had a more positive attitude about a mask. They had more positive feelings about the typical person who always wears the mask. And females reported a greater sense of control compared to males. So just to summarize what we found in mask wearing, many adults indicated that they do always wear a mask. However, we know that there are opportunities to grow that behavior and in our communities. People do have positive attitudes about wearing a mask. People also have protective beliefs about wearing a mask, but we learned that some beliefs that people have might inhibit them wearing a mask. And understanding the beliefs that positively influence mask wearing are important if we're going to grow that protective behavior. It can help us to inform decisions about messaging and strategies. And then we want to bolster the perceived norms. We want to bolster the growing the perception that people are supportive of mask wearing, and that will likely increase that behavior as well. So now I want to shift to our focus on vaccines. The other protective behavior that we focused on was getting a vaccine for COVID-19. And I know there is a lot of anticipation. I know that one of the vaccines has been rolling out this week. Many others are in phase 3 trials and moving forward quite well. However, given the unprecedented speed in which vaccine for COVID-19 is becoming available, there has been talk and concern that people might be reluctant to get a COVID-19 vaccine. We know that vaccines are an effective public health strategy to prevent disease, but the effectiveness of this strategy really relies on people's willingness to be vaccinated. A vaccine to prevent COVID-19 is only going to be effective if people choose to be vaccinated. I was listening to a webinar that was sponsored by the American Public Health Association and the National Academy of Medicine. And it was said in that discussion that vaccines don't save lives, vaccinating people saves lives. And that really stuck out for me as I was thinking about our survey and understanding the beliefs that are influencing people's decisions about a COVID-19 vaccine. Vaccine confidence and acceptance is critical. What we found in our survey is that only about half of the respondents, about 50.9%, indicated that they would agree to be vaccinated if a vaccine was approved to prevent COVID-19 and it was available at no cost. About 30% said they would not agree to be vaccinated, and about 20% didn't know. They weren't sure if they would agree to be vaccinated. We have a lot of opportunities here. We have a lot of work to do. Hesitancy to get a vaccine to prevent COVID is likely to raise some really unique challenges for public health in the coming months. Strategies to increase vaccine confidence and acceptance, especially given the devastating consequences of COVID-19, will be critical. Like wearing a mask, getting a vaccine is also a deliberate behavior that results from an individual's willingness or openness to the behavior and their future intentions. And when we look at intention and willingness to get vaccinated, there is intention and willingness, which is good. because we found that there is a strong and positive correlation between intention and willingness and getting a vaccine. Many adults had favorable attitudes about getting a vaccine, and I again tried to highlight those in green and red. Many thought it was necessary and safe and smart, but there were some attitudes that some felt that it was unnecessary, that it was dangerous and harmful. People who had a positive attitude about getting a vaccine reported agreement to get vaccinated 2.3 times more often than people with a negative attitude. So we want to grow the positive attitudes because they are positively correlated with people's willingness and intention. And if we grow those positive attitudes, we're likely to increase vaccine uptake. Similarly, we looked at a variety of beliefs people have about getting a vaccine. And while many do have positive beliefs, there are some beliefs that might inhibit people from getting a vaccine. Here is a list of various beliefs that we asked. And again, I highlighted some red and green to show you just kind of the behavioral beliefs that might promote people to get or promote vaccine uptake, and then again, some of the beliefs that might inhibit people from getting a vaccine. For example, you can see that some of the behavioral beliefs that might inhibit people, 64%, for example, agreed that they would be concerned about the effectiveness of a vaccine. 63% would be concerned with the side effects of a vaccine for COVID-19. And 45% of the adults in this survey believe that there will be harmful chemicals in an FDA-approved vaccine to prevent COVID. Further, we did see some misperceptions that people have about vaccines. So for example, we asked respondents, how much they agreed with the statement, childhood vaccines cause autism. And even though there is a lot of research out there about this, there was still over 30% of the respondents in our survey that believe that to be true or agree with that statement. Similarly, some adults, 34%, said that they agreed that they don't need to get a vaccine to prevent COVID-19 because other people will get a vaccine. So we have some work to do to educate on vaccine safety and effectiveness and to correct some of the misperceptions that are out there. If we do that, we're likely to increase people's willingness and intentions to get a vaccine. Many adults, about 57%, agree that people who care about them want them to get a vaccine when it is available. We had about 22% who disagreed with that statement. People who perceived high expectations from others important to them that they should get vaccinated reported agreement to get vaccinated 2.5 times more often than people who perceived low expectations. Perceived injunctive norms were strongly correlated with people's willingness and intention. Therefore, when we think about interventions, when we think about strategies to increase people's acceptance of a vaccine, we might want to think about, again, family members and friends asking someone else to get a vaccine. Those efforts could focus on asking the people that they care about to get vaccinated. About half of the adults in our survey, 51%, believe that most people like themselves will get a vaccination to prevent COVID-19. And people who perceived other adults like themselves or perceived that most other adults will get vaccinated reported agreeing to get vaccinated 3.7 times more often than people who perceived that most other adults would not get vaccinated. And again, these perceived descriptive norms were correlated with people's willingness to get vaccinated and their intention. We also looked at some of the male and female differences. And we did find that males reported behaviors and beliefs more supportive of getting a vaccine than females. And this is interesting because we found the opposite for mask wearing. The takeaway messages for vaccines that we found in our data, while there were many adults that they indicated that they did intend to get a vaccination for COVID-19, there are a lot of opportunities to grow that protective behavior. In there, we found about 30% who were really unsure. Those were the people that weren't sure or on the fence about getting it. So we know that there's a lot of opportunity there. Many adults did have positive attitudes about it, but there were also some negative attitudes. And we know that growing those positive attitudes will likely increase people's willingness and intention to get vaccinated. That many adults had protected beliefs about getting vaccinated, but some of those beliefs, some beliefs may inhibit people from getting vaccinated. And we know that, understanding the beliefs that can positively influence getting a vaccine are important to grow that protective behavior and can help inform decisions about what messages are going out there, what strategies are we using to increase people's willingness and intention to get vaccinated. We want to bolster perceived norms and growing the perception of support about getting a vaccine. That will likely increase that protective behavior. And then we want to correct misperceptions about vaccines. Educating people on vaccine safety and effectiveness will likely increase vaccine uptake. From our standpoint, if you are tasked with bringing this information to people, we wanted to think about who are the messengers? Who are the messengers for this information? As we know, there are a lot of ways that people are getting information about COVID-19, and we wanted to dig in a little bit and learn about the trusted sources of information for COVID-19. Who did people believe were the trusted sources? We knew we wanted to understand this because we know that who delivers a message can really impact a person's reaction to the message in some important ways. And as we think about strategies to increase mask wearing and acceptance of a vaccine, trusted sources for information about COVID-19 will be important, especially when we're making decisions about who's going to deliver the messages that we're putting out there to increase those protective behaviors. We learned that most adults trust their local healthcare providers. They trust their local county and city public health offices and their state public health offices. So when we think about how that translates to messages, we might want to think about using, local healthcare providers to record PSAs. Fewer adults trusted information about COVID-19 from television news stations, the White House, and other social media. We also learned that there is a general sense that there is misinformation about COVID-19, and many adults, I think there was about 41%, who believed that misinformation about COVID-19 makes it really difficult to know what to believe and how to protect themselves. So trusted sources, I think this is some important insight, especially if you're tasked with thinking about how do we get information out there. Now I want to turn our attention to what we do with the information and to talk specifically about how we can operationalize this information in our work to improve health and safety. So while these results show that many adults have positive beliefs and attitudes and behaviors about wearing a mask and getting a vaccine, we know that there are opportunities to grow these behaviors. So we want to get that information out there and share and discuss the results. Changing culture is about conversation. When we engage in meaningful conversations, it's an important strategy to change behavior. We know that conversations can foster engagement and collaboration, and they can create interest. It can encourage people to take action. Within this survey, there was a lot of positive shared attitudes and beliefs. So it's really important to leverage those that already exist. Often from media and news, we find people underestimate engaging in protective behaviors. Some people don't think that most people wear a mask, and some people don't think that most people will get a vaccine. And part of the work is to not inadvertently promote those misperceptions that people are not engaging in protective behaviors. Even if it's unintentional, it can decrease protective behaviors by some people. We might be actually making it worse if we do that. So we want to really focus on the shared positive attitudes and beliefs, and we know that conversation is one of the most important ways to do that. Conversations really change beliefs, and beliefs can change behaviors. Sometimes, I don't know, I think most of us have been in a situation where we might be giving information and we start to get, yeah, but, those yes, but answers. Yeah, but I don't know if that's true for everyone, or yes, but, and then a response. And sometimes we can get some resistance. We want to listen for those yes, but responses. And when we hear them, we want to just stop for a minute and try not to argue back like, oh, you don't know what you're talking about, but really to encourage a continued dialogue. Oftentimes, if we start to argue for one side, a person who has beliefs that are in opposition to what we're saying might actually try and hold on to their resistance, hold on to their position. So it's really best to really reflect and roll with that resistance if you're starting to meet that, instead of meeting that head on. One strategy that's a popular strategy for rolling with resistance, if you start to get some, is in this acronym OARS, and it stands for open questions, affirmations, reflective listening, and summary statements. And I'm not going to go into a ton of detail on these, but I have found them so helpful in talking through something with a person who might have different ideas or might have different beliefs. Open questions are just a way of continuing the dialogue, helping a person to continue to be in a conversation with you. So things like, what surprised you about what I'm talking about? Or, you know, what do we still need to learn? Those are the kinds of questions that don't have a yes or no response, and they can help us to establish that atmosphere of trust and respect. We want to avoid those questions with yes or no, like, don't you think this is awful, or don't you think that we have to do whatever it is? So thinking about how do we present open-ended questions. Using affirmations is also an interesting and I think effective way to kind of deal with some of that resistance that you might get. Affirmations are statements or gestures that really recognize, you know, acknowledge the other person's point of view. Like an affirmation might be like, wow, I really appreciate you taking the time to talk with me, or I appreciate your willingness to continue this conversation. Really just recognizing and affirming that a person's in a dialogue with you. We can also use reflective listening, and although that sounds easy, it's sometimes difficult to do. Reflective listening really can include things like repeating or rephrasing what you've heard the person tell you. So you could use reflective statements like, let me see, you're saying that this is what you think, or it feels to you like this is happening, or you're not so concerned about whatever it is you're talking about. So using some reflective statements, also a great strategy just to continue the conversation with another person. And then summarizing, really summarizing what you heard. You could say like, let me rephrase what I heard and see if I got everything, or asking, did I miss anything after you've rephrased what you've heard? And remember, as you're talking about data, or you're talking about, you know, things that we know about mask wearing or getting a vaccine, just remember, it is completely okay to not have all the answers. And it's really about the relationship that you establish through the conversations that you're having that are the most important. We also, not only do we want to get the information out there and have those conversations, but we want to consider the existing strategies that we're using and seek to frame those communications in the context of safety. There are positive beliefs already present about these behaviors, and we want to seek to highlight those. When we frame communications in the context of safety, we can then speak to the shared values and attitudes and beliefs that are already positive, that we already have. Now, some of you might be thinking like, whoa, I'm not directly in control of messaging or getting the information out there. But just remember, just those conversations, we all have a stake in this. And this is the kind of information that we want to get out there, that we want to start those conversations with. The data that we collected was from a large national sample, but we know what beliefs vary and can influence by the cultural groups or the social groups that we identify with. So you might want to consider understanding specific beliefs in your state or in your local community. You know, what beliefs to focus on and grow might change slightly depending on, you know, if you're in Montana or if you're in New York City. And you can use the information really to guide decisions about what beliefs to focus on and grow to increase wearing a mask and getting a vaccine in your specific context. So what's next? From this study, we learned some really important information about the cultural factors. And we can use that data that we learned to increase these protective behaviors. The exploration of this topic really provided us with some interesting information, but we left this survey specifically with so many more questions and a lot more learning to be done. We know the COVID-19 pandemic has challenged us in many ways, and we are learning new information all of the time. We're in a place with a lot of questions. We'd love to continue to explore these beliefs in different communities across the country, exploring ways we can grow these beliefs that are supportive of mask wearing and getting a vaccine. We're doing some additional analysis of this data and hoping to publish the results soon. We're looking specifically at some interesting information regarding trusted sources of information and these protective behaviors. I also put an updated version of the key findings report on our Center for Health and Safety Culture.org website, chscculture.org website. So if you're interested in learning more about that, please download the key findings report. I think it has just a real good overview of all of the things that we talked about today. And for us, we've actually also started some conversations with healthcare, seeking to learn about the cultural factors that are influencing these protective behaviors among healthcare. We know that the vaccine is rolling out like now, and this week anyway, and we're really interested and have been talking with healthcare to learn about the beliefs that we might need to grow, not only to foster uptake of the vaccine, but really to explore the behaviors and beliefs post-vaccine, so after people have already gotten the vaccine. So that's an interesting avenue that we're hoping to explore in the very near future. And if you're interested in talking more about that, please shoot me an email too. So I know that the work you are doing on COVID-19 is extremely important work, and I really do appreciate you spending time with me today. I know there's a lot of energy and focus and for everyone on this effort. Please feel free to reach out to us at the Center for Health and Safety Culture if there are ways that we can support any of your efforts that you're doing in your communities across the country. I wanted to leave some time for questions, and that kind of wraps up the presentation part, but I am going to check on the question and answer box and leave a couple of minutes to answer any questions people have. So let me go ahead and scan the question and answer box now. So there is a question, Robert, that came in, and I think this is an important one. Robert said, correcting misperceptions about vaccine safety and effectiveness is very, very difficult because of the limited literacy about trusted sources and what constitutes a trustable source. How do we change that? Social media is a serious problem, And Robert, I think that is such an interesting dilemma that we're in. And we're just in the beginning stages of exploring some of that in doing some additional analysis on what are those trusted sources and how are we going to get out information, and what are those who are those trusted sources? I know, there are differences in people who view social media as a trusted source, and that absolutely is a challenge. And I think from our perspective, how are we going to tackle that? Do we need to get on and start to really use those sources to leverage some of the information that we know? I don't think is any easy answer to that question, because it absolutely is a challenge in the work that we're doing. There's another question that came in is, can we post the link to our report here? Yes, I absolutely can. It is on our chsculture.org website right now. If you go to our site, it's right on the front there, and I posted the key findings report there, so that you can get it there. I will also post it in the chat, so you can just grab it from that link. Is the PowerPoint available? And we will put it on our YouTube channel so that it is available and you can watch it again and share it with others. Another question came in about why did mask wearing become political? Why are some self-centered about rights or outward looking to help others? Boy, that is such a good question. I have definitely pondered what has caused some of that controversy. And I think it's so multifaceted. When I was thinking about and looking into some of that, I think partly maybe in that very early stage of the pandemic, there was some trusted sources that, put out statements like, ooh, is that important for healthy adults to wear a mask? And that we didn't, that there wasn't a lot of efficacy out there or research out there about that. And since then that was changed, absolutely. So I don't know if that was just put some doubt into people's minds. I know that, there has been some, there definitely has been a political. That's why I think when I think about messaging, we want to definitely go back to framing our communications in the context of safety. There is another question about what are the attitudes of insurance to pay for COVID vaccines if there is a cost? And that's a great question. I am not really familiar with that. I know that they're rolling out, I don't know. I couldn't say that I know about the attitudes of insurance, but that would be definitely an interesting avenue to explore. I'm sorry, I don't know the answer to that. There was a question about comparing data among participants' residents, since some states and counties required mask wearing and some did not. We did not specifically look at it by county or by residents. No, we didn't look at the data that way. We did ask a question on willingness and whether people's willingness to wear a vaccine or to wear a mask was influenced by a mandate. And people were definitely willing to wear a mask in those situations, and it might have gone up slightly. I don't have that specifically. And then a final question that came in, are there any ideas on why females were less likely to get themselves vaccinated? And that I honestly thought it would be the other way around. And that's interesting. That came from Kara. I'm not sure exactly why that was, because we do know in the literature that generally, in general, in other studies, females were more willing to engage in those protected behaviors. So I'm not exactly sure on why that was. All right, I think that's all the questions that came in. I really appreciate everyone taking the time today. I will post the link to the KE findings report in the chat, and have a great rest of your afternoon.